Which nursing intervention is an independent function of the professional nurse? A. Administering oral analgesics. B. Requesting diagnostic studies. C. Teaching the patient perineal care. D. Providing wound care to a surgical incision. Answer. C. Teaching the patient perineal care. Rationale. Nurses are now responsible for various independent functions, including teaching, counseling, and intervening in non-medical problems. Interventions initiated by the physician and carried out by the nurse are called dependent functions. Administering oral analgesics is a dependent function. It is initiated by a physician and carried out by a nurse. Requesting diagnostic studies is a dependent function. Providing wound care is a dependent function, however. The physician prescribes the type of wound care through direct orders or protocol. The patient makes the statement, "I'm afraid to take the baby home tomorrow." Which response by the nurse would be the most therapeutic? A. You're afraid to take the baby home? B. Don't you have a mother who can come and help? C. You should read the literature I gave you before you leave. D. I was scared when I took my first baby home, but everything worked out. Answer. A. You're afraid to take the baby home? Rationale. This response uses reflection to show concern and open communication. The other choices are blocks to communication. Asking if the patient has a mother who can come and assist blocks further communication with the patient. Telling the patient to read the literature before leaving does not allow the patient to express her feelings further. Sharing your own birth experience is inappropriate. Which statement best describes the advantage of a labor, birth, recovery, and postpartum (LDRP) room? A. The family is in a familiar environment. B. They are less expensive than traditional hospital rooms. C. The infant is removed to the nursery to allow the mother to rest. D. The woman's support system is encouraged to stay until discharge. Answer. D. The woman's support system is encouraged to stay until discharge. Rationale. Sleeping equipment is provided in a private room. A hospital setting is never a familiar environment to new parents. An LDRP room is not less expensive than a traditional hospital room. The baby remains with the mother at all times and is not removed to the nursery for routine care or testing. The father or other designated members of the mother's support system are encouraged to stay at all times. Which response by the nurse is the most therapeutic when the patient states, "I'm so afraid to have a cesarean birth"? A. Everything will be okay. B. Don't worry about it. It will be over soon. C. What concerns you most about a cesarean birth? D. The physician will be in later and you can talk to him. Answer. Circa, what concerns you most about a cesarean birth? Rationale. The response, what concerns you most about a cesarean birth, focuses on what the patient is saying and asks for clarification. Which is the most therapeutic response? The response, everything will be okay, is belittling the patient's feelings. The response, don't worry about it. It will be over soon, will indicate that the patient's feelings are not important. The response, the physician will be in later and you can talk to him, does not allow the patient to verbalize her feelings when she wishes to do that. In which step of the nursing process does the nurse determine the appropriate interventions for the identified nursing diagnosis? A. Planning. B. Evaluation. C. Assessment. D. Intervention. Answer. A. Planning. Rationale. The third step in the nursing process involves planning care for problems that were identified during assessment. The evaluation phase is determining whether the goals have been met. During the assessment phase, data are collected. The intervention phase is when the plan of care is carried out. Which nursing intervention is written correctly? A. Force fluids as necessary. B. Observe interaction with the infant. C. Encourage turning, coughing, and deep breathing. D. Assist to ambulate for 10 minutes at 8 a.m., 2 p.m., and 6 p.m. Answer. D. Assist to ambulate for 10 minutes at 8 a.m., 2 p.m., and 6 p.m. Rationale. Interventions might not be carried out if they are not detailed and specific. Force fluids is not specific. It does not state how much or how often. Encouraging the patient to turn, cough, and breathe deeply is not detailed or specific. Observing interaction with the infant does not state how often this procedure should be done. Assisting the patient to ambulate for 10 minutes within a certain time frame is specific. Expectant parents ask a prenatal nurse educator. Which setting for childbirth limits the amount of parent-infant interaction? Which answer should the nurse provide for these parents in order to assist them in choosing an appropriate birth setting? A. Birth center. B. Home birth. C. Traditional hospital birth. D. Labor, birth, and recovery room. Answer. C. Traditional hospital birth. Rationale. In the traditional hospital setting, the mother may see the infant for only short feeding periods, and the infant is cared for in a separate nursery. Birth centers are set up to allow an increase in parent-infant contact. Home births allow the greatest amount of parent-infant contact. The labor, birth, recovery, and postpartum room setting allows for increased parent-infant contact. The RN is delegating tasks to the unlicensed assistive personnel, UAP. Which tasks can the nurse delegate? Select all that apply. A. Teaching the patient about breast care. B. Assessment of a patient's lochia and perineal area. C. Assisting a patient to the bathroom for the first time after birth. D. Vital signs on a postpartum patient who delivered the night before. E. Assisting a postpartum patient to take a shower on the second postpartum day. Answer. D. Vital signs on a postpartum patient who delivered the night before. E. Assisting a postpartum patient to take a shower on the second postpartum day. Rationale. Nurses must be aware that they remain legally responsible for patient assessments and must make the critical judgments necessary to ensure patient safety when delegating tasks to unlicensed personnel. The nurse cannot delegate assessment, teaching, or evaluation. The two tasks that the nurse can delegate are vital signs on a stable postpartum patient and assisting a stable postpartum patient on the second postpartum day to take a shower. Which goal is most appropriate for the collaborative problem of wound infection? A. The patient will not exhibit further signs of infection. B. Maintain the patient's fluid intake at 1,000 milliliters 8 hours. C. The patient will have a temperature of 98.6 F within 2 days. D. Monitor the patient to detect therapeutic response to antibiotic therapy. Answer. D. Monitor the patient to detect therapeutic response to antibiotic therapy. Rationale. In a collaborative problem, the goal should be nurse-oriented and reflect the nursing interventions of monitoring or observing. Monitoring for complications such as further signs of infection is an independent nursing role. Intake and output is an independent nursing role. Monitoring a patient's temperature is an independent nursing role. The nurse is formulating a nursing care plan for a postpartum patient. Which actions by the nurse indicate use of critical thinking skills when formulating the care plan? Select all that apply. A. Using a standardized postpartum care plan. B. Determining priorities for each diagnosis written circa writing interventions from a nursing diagnosis book. D. Reflecting and suspending judgment when writing the care plan. E. Clustering data during the assessment process according to normal versus abnormal. Answer B. Determining priorities for each diagnosis written. D. Reflecting and suspending judgment when writing the care plan. E. Clustering data during the assessment process according to normal versus abnormal rationale. Critical thinking focuses on appraisal of the way the individual thinks, and it emphasizes reflective skepticism. Determining priorities, reflecting and suspending judgment, and clustering data are actions that indicate the use of critical thinking. Using a standardized care plan and writing interventions from a nursing diagnosis book do not show that reflection about the patient's individual care is being done. Regarding advanced roles of nursing, which statement related to clinical practice is the most accurate? A. Family nurse practitioners, FNPs, can assist with childbirth care in the hospital setting. B. Clinical nurse specialists, CNSs, provide primary care to obstetric patients. C. Neonatal nurse practitioners provide emergency care in the post-birth setting to high-risk infants. D. A certified nurse midwife, CNM, is not considered to be an advanced practice nurse. Answer: C. Neonatal nurse practitioners provide emergency care in the post-birth setting to high-risk infants. Rationale: neonatal NPs provide care for the high-risk neonate in the birth room and in the neonatal intensive care unit, as needed. FNPs do not participate in childbirth care, however. They can take care of uncomplicated pregnancies and post-birth care outside of the hospital setting. CNSs work in hospital settings but do not provide primary care services to patients. A CNM is an advanced practice nurse who receives additional certification in the specific area of midwifery. Which nursing diagnosis should the nurse identify as a priority for a patient in active labor? A. Risk for anxiety related to upcoming birth. B. Risk for imbalanced nutrition related to NPO status. C. Risk for altered family processes related to new addition to the family. D. Risk for injury, maternal, related to altered sensations and positional or physical changes. Answer: D. Risk for injury, maternal, related to altered sensations and positional or physical changes. Rationale: the nurse should determine which problem needs immediate attention. Risk for injury is the problem that has the priority at this time because it is a safety problem. Risk for anxiety, imbalanced nutrition, and altered family processes are not the priorities at this time. The nurse is assessing a patient's use of complementary and alternative therapies. Which should the nurse document as an alternative or complementary therapy practice? Select all that apply. A. Practicing yoga daily. B. Drinking green tea in the morning. C. Taking omeprazole, Prilosec, once a day. D. Using aromatherapy during a relaxing bath. E. Wearing a lower back brace when lifting heavy objects. Answer: A. Practicing yoga daily. B. Drinking green tea in the morning. D. Using aromatherapy during a relaxing bath. Rationale: complementary and alternative (CAM) therapies can be defined as those systems, practices, interventions, modalities, professions, therapies, applications, theories, and claims that are currently not an integral part of the conventional medical system in North America. Yoga is considered to be a mind-body alternative therapy. Green tea and aromatherapy are biologically based complementary therapies. Prilosec and the use of a lower back brace would be therapies consistent with those used by conventional medicine. The nurse is writing an expected outcome for the nursing diagnosis: acute pain related to tissue trauma, secondary to vaginal birth, as evidenced by patient stating pain of 8 on a scale of 10. Which expected outcome is correctly stated for this problem? A. Patient will state that pain is a 2 on a scale of 10. B. Patient will have a reduction in pain after administration of the prescribed analgesic. C. Patient will state an absence of pain 1 hour after administration of the prescribed analgesic. D. Patient will state that pain is a 2 on a scale of 10, 1 hour after the administration of the prescribed analgesic. Answer: D. Patient will state that pain is a 2 on a scale of 10, 1 hour after the administration of the prescribed analgesic. Rationale: the outcome should be patient-centered, measurable, realistic, and attainable and within a specified time frame. Patient stating that her pain is now 2 on a scale of 10 lacks a time frame. Patient having a reduction in pain after administration of the prescribed analgesic lacks a measurement. Patient stating an absence of pain 1 hour after the administration of prescribed analgesic is unrealistic. In consideration of the historic evolution of maternity care, which treatment options were used over the past century? Select all that apply. A. During the 19th century, women of privilege were delivered by midwives in a hospital setting. B. Granny midwives received their training through a period of apprenticeship. C. The recognition of improved obstetric outcomes was related to increased usage of hygienic practices. D. A shift to hospital-based births occurred as a result of medical equipment designed to facilitate birth. E. The use of chloroform by midwives led to decreased pain during birth. Answer: B. Granny midwives received their training through a period of apprenticeship. C. The recognition of improved obstetric outcomes was related to increased usage of hygienic practices. D. A shift to hospital-based births occurred as a result of medical equipment designed to facilitate birth. Rationale: training of granny midwives was done by apprenticeship as opposed to formal medical school training. With the advent of usage of hygienic practices, improved health outcomes were seen with regard to a decrease in sepsis. New equipment such as forceps enabled easier birth. Women of privilege in the 19th century delivered at home, attended by a midwife. Chloroform was used by physicians and was not available to midwives. The nurse states to the newly pregnant patient, "Tell me how you feel about being pregnant." Which communication technique is the nurse using with this patient? A. Clarifying. B. Paraphrasing. C. Reflection. D. Structuring. Answer: A. Clarifying. Rationale: the nurse is attempting to follow up and check the accuracy of the patient's message. Paraphrasing is restating words other than those used by the patient. Reflection is verbalizing comprehension of what the patient has said. Structuring takes place when the nurse has set guidelines or set priorities. When reviewing a new patient's birth plan, the nurse notices that the patient will be bringing a doula to the hospital during labor. What does the nurse think that this means? A. The patient will have her grandmother as a support person. B. The patient will bring a paid, trained labor support person with her during labor. C. The patient will have a special video she will play during labor to assist with relaxation. D. The patient will have a bag that contains all the approved equipment that may help with the labor process. Answer: B. The patient will bring a paid, trained labor support person with her during labor. Rationale: A doula is a trained labor support person who is employed by the mother to provide labor support. She gives physical support such as massage, helps with relaxation, and provides emotional support and advocacy throughout labor. A doula is usually not a relative of the woman. A doula is a trained labor support person. Many communities now offer the availability of freestanding birth centers to provide care for low-risk women during pregnancy, birth, and postpartum. When counseling the newly pregnant patient regarding this option, the nurse should be aware that this type of care setting includes which advantages. Select all that apply. A. Staffing by lay midwives. B. Equipped for obstetric emergencies. C. Less expensive than acute care hospitals. D. Safe, home-like births in a familiar setting. E. Access to follow-up care for 6 weeks postpartum. Answer: C. Less expensive than acute care hospitals. D. Safe, home-like births in a familiar setting. E. Access to follow-up care for 6 weeks postpartum. Rationale: patients who are at low risk and desire a safe, home-like birth are very satisfied with this type of care setting. The new mother may return to the birth center for postpartum follow-up care, breastfeeding assistance, and family planning information for 6 weeks postpartum. Because birth centers do not incorporate advanced technologies into their services, costs are significantly less than in a hospital setting. The major disadvantage of this care setting is that these facilities are not equipped to handle obstetric emergencies. Should unforeseen difficulties occur, the patient must be transported by ambulance to the nearest hospital. Birth centers are usually staffed by certified nurse midwives, CNMs. Which of the following statements highlights the nurse's role as a researcher? A. Reading peer-reviewed journal articles. B. Working as a member of the interdisciplinary team to provide patient care. C. Helping patient to obtain home care post-discharge from the hospital. D. Delegating tasks to unlicensed personnel to allow for more teaching time with patients. Answer: A. Reading peer-reviewed journal articles. Rationale: a nurse in a researcher role should look to improve her or his knowledge base by reading and reviewing evidence-based practice information as found in peer-reviewed journals. Working as a member of the interdisciplinary team to provide patient care indicates that the nurse is working as a collaborator. Helping the patient to obtain home care post-discharge from the hospital indicates that the nurse is working as a patient advocate. Delegating tasks to unlicensed personnel in order to allow for more teaching time with patients indicates that the nurse is working as a manager. A hospital has achieved magnet status. Which indicators would be consistent with this type of certification? A. There is stratification of communication in a directed manner between nursing staff and administration. B. There is increased job satisfaction of nurses, with a lower staff turnover rate. C. Physicians are certified in their respective specialty areas. D. All nurses have baccalaureate degrees and certification in their clinical specialty area. Answer: B. There is increased job satisfaction of nurses, with a lower staff turnover rate. Rationale: magnet status is a certification offered by the ANCC, American Nurses Credentialing Center, in which hospitals apply based on designated criteria that consider nurse job satisfaction, staff patterns, strength, quality of nursing staff, and open communication. It is not based on physician status. Also, certification is not required for all nurses at this point. The expectation with magnet status is that nurses will continue to expand their knowledge by earning additional degrees and certification. Which statement is true regarding the shortage of nurses in the United States? A. There are a larger proportion of younger nurses in the workforce as compared with older nurses. B. As a result of decreased RN to patient ratios, there is a decrease in patient mortality in the clinical setting. C. Nursing programs are turning away qualified applicants. D. There are adequate classroom and clinical facilities for training RNs. Answer: C. Nursing programs are turning away qualified applicants. Rationale: according to an Institute of Medicine (IOM) report, by the year 2020, 80% of new RNs should hold baccalaureate degrees. Despite this need, baccalaureate and master's programs are turning away qualified applicants due to an insufficient number of faculty. There are a larger proportion of older nurses in the workforce based on current research by the IOM. Increased nurse-to-patient ratios have resulted in decreased patient mortality in the clinical setting. There are currently numerous limitations of both classroom and clinical facilities necessary to train new nurses adequately. A prima para patient asks about possible support options for her during the labor process. She is apprehensive that her family members will not be prepared to assist her during this time. Which option would be most effective for this patient? A. Reassure the patient that the labor and birth staff consists of highly trained nurses who are well educated to take care of laboring patients, so that should be sufficient. B. Encourage the patient to take prepared childbirth classes with her husband, because that should provide the best support by a family member. C. Provide information to the patient about obtaining a doula during the labor process. D. Tell the patient that this is a normal feeling based on fear of the unknown and that it will subside once she starts the labor process. Answer: C. Provide information to the patient about obtaining a doula during the labor process. Rationale: providing information about a doula addresses the patient's concern because the doula's designated role is to provide support during labor. Although it is true that labor and birth nurses are trained in their specialty, the patient is voicing concern for support, so her feelings should not be minimized. Encouraging the patient to take prepared childbirth classes is also important. However, it does not address the patient's concern for support. Because this patient is a prima para, it is normal to have some anxiety over the unknown process of the labor experience, but again, this response minimizes the patient's concern. A nurse educator is teaching a group of nursing students about the history of family-centered maternity care. Which statement should the nurse include in the teaching session? A. The Shepherd-Towner Act of 1921 promoted family-centered care. B. Changes in pharmacologic management of labor prompted family-centered care. C. Demands by physicians for family involvement in childbirth increased the practice of family-centered care. D. Parental requests that infants be allowed to remain with them rather than in a nursery initiated the practice of family-centered care. Answer: D. Parental requests that infants be allowed to remain with them rather than in a nursery initiated the practice of family-centered care. Rationale: as research began to identify the benefits of early, extended parent-infant contact, parents began to insist that the infant remain with them. This gradually developed into the practice of rooming in and finally to family-centered maternity care. The Shepherd-Towner Act provided funds for state-managed programs for mothers and children but did not promote family-centered care. The changes in pharmacologic management of labor were not a factor in family-centered maternity care. Family-centered care was a request by parents, not physicians. Which patient could safely be cared for by a certified nurse midwife? A. Gravida 3, Para 2, with no complications. B. Gravida 1, Para 0, with mild hypertension. C. Gravida 2, Para 1, with insulin-dependent diabetes. D. Gravida 1, para 0, with borderline pelvic measurements. Answer: A. Gravida 3, para 2, with no complications rationale. A certified nurse midwife, CNM, cares for women who are at low risk for complications. The CNM would not care for a woman with hypertension. The CNM would not care for a woman with insulin-dependent diabetes. The CNM would not care for a woman with borderline pelvic measurements.